Welcome to the Wellness Rebel Show, where you reclaim your health and tap into your body's healing power. I'm your host, Fatima, here to empower you with the knowledge and tools to take charge of your well-being. Whether you want to boost energy, improve mindset, or unlock vitality, this is your go-to source for practical advice and inspiration. It's time to step into your power and live a life of health and freedom. Welcome to the revolution. Today we have Liz, the doula. She's been my friend since 2009.
10.
9? 9? No,
I think
9.
one of the two.
Well, we worked together. We were pool girls in Vegas, and I never knew that we would end up here as mothers and just being these wellness rebels. And she's here today to share about her journey and tell us all the things we need to know if we want to have a birth that is like
I would say just
a birth
birthing
that you
outside the
want.
system.
Would that be the right
Yeah,
term, right?
yeah. I mean, it's birthing outside the system, even if you're in the system. So, like, even if you're choosing, because 97% of births happen in a hospital. So, you have to kind of almost speak to the majority here, because I feel like people who are going home birth and birth center birth, a lot of them have done like a ton of research, right? Like outside of that and kind of know more of what they want. But once you're in the system with like the hospital, you kind of just get put through without ever really being told your options or that there are options, or where we just kind of blindly trust practitioners. And so I wanted to become a doula. My first birth I ever did was in 2012, and it's because a lot of my friends started having babies, and all of them were telling me how they were ending up in cesareans, but the stories that they were telling didn't really make sense to me. Like their doctor just told them, "Oh, your baby's too big," so they scheduled a C-section. They weren't ever given like options or choices, and then their babies were born and they weren't big babies. And I'm like, something's not right here. So I really wanted to become a doula, and so I started way back when, but did it more full time like in the last 5 years. But I love how you've kind of like coined this like rebellious women, because I feel like it goes into all health stuff, right? Like we've all been told our whole life. Like I remember in my 20s having severe pain and cramping, and like it wasn't when I was on my period and going to the doctor, and their only solution ever was birth control. And I was like, I don't want to be on birth control. And then they're like, well, we can't help you then. Or I had like a thyroid thing in my 20s, and I worked with a functional practitioner, and I was able to heal some stuff versus like getting put on a medication. And for some reason, I've always just kind of had a rebellious spirit. I didn't grow up like crunchy at all. I grew up very much like when you're sick, you get on antibiotics, and we ate casseroles and processed food, and we microwave plastic and all of it. Like I didn't learn any of this stuff except for like on my own, and a lot from my older sister.
Right.
But thankfully, I got introduced to some stuff like in my 20s to start making those changes. But I mean, the work's never like fully done, but I'm excited to talk about maybe rebellious birth, because you're kind of probably going against like what your providers like what providers in a hospital like might recommend. But yeah, I mean, I'm super excited to be here. I've been a doula for over a decade, and super, super passionate about this work, and not just like birth work, but like women's health. And there's so much that can play into your birth story, including your health and like minerals that get depleted, and how you find out later, even just like they preach on calcium in birth or toward the end of pregnancy, like people's iron is low, or I can't tell you how many people are like, oh yeah, I'm low on iron, so they want me to take an iron supplement, but nobody's telling them that blindly taking an iron supplement, you're depleting other things, and how things happen for a reason, like it's just interesting like how it all comes together. So I'm really excited to chat about it today.
I love that. We kind of have the similar journeys. Like I wasn't always holistic. We took medication growing up, period pain, like feeling like I was getting stabbed from the inside when I had my period, had to skip school. So, and yeah, I never also, you know, well, the only reason too that I looked into home births was because I was going with my younger sister to her OBGYN appointment when she was pregnant, and it always boggled my mind that we would have to sit for a long time for your appointment time, and then you have to wait for them, then you have to wait for them in another waiting room, and then you get seen for 5 or 10 minutes. And I just felt like it was very impersonal, and that's kind of what made me, get into, like, look into home births. And yeah, I so with you, was it because your sister was pregnant and then you kind of like looked into that? Is that what kind of started you in that journey?
Yeah, well, my first introduction to birth was, I don't know, I was maybe like 21. Yeah, probably 21. My sister had a home birth with her first. So that was the first birth I ever witnessed. And it was amazing. And it looked so hard. It was a very long, hard, tough labor. And I'm like, I question, like, do I want to have kids after watching her struggle so much with her first? But yeah, like just that intimacy with her midwife and how my whole family was there. Like my dad basically, my dad filled up the tub for all of my sister's births. It's so cute. So my sister had 4 home births, and my dad's the one who like empties out the tub and helps clean up the afterbirth and like all of this stuff. And he's so sweet. So my dad was like in the kitchen, like cooking and hanging out and just getting random things we needed. And my mom was cooking for the midwives, and I was just hanging out. And it was just like such a cool environment. And then that's when a few years later, a lot of my friends were having babies and they were all ending up in cesareans. And I'm like, wait, like my only exposure to birth was like so different. And like my sister and I both truly believe that if we weren't in the settings we were in with our first, we would have been C-section births. Like she pushed for over 5 hours with her first, probably close to 6. And she was stuck for a long, long time. And in the hospital, failure to progress, what they call failure to progress, is the number one reason for C-sections. The number 2 reason is fetal heart tones. And in my first birth, I was in a hospital, but I was with a midwife group who I knew because I had worked with them as a doula. And while I was pushing my daughter out, a nurse bursts into the room and tells my midwife, like, the OB wants to know why you're not prepping her for a C-section right now. And the midwife goes, because she's literally pushing her baby out. Jovi was having big D cells and was having a really hard time recovering. And so the OB was like, call it, whereas like my midwife advocated for me, and she knows that she would never put me or my baby in danger. And midwives err on the side of like really knowing what's normal, and that there are variabilities and there are different things that can happen. And the majority of the time, like, you can work with it. Are there certain times like when there needs to be intervention? Like, absolutely. But for most women birthing, everything's going to go fine. Even like the majority of women are actually lower risk. But if you're with a hospital set in an OB practice, you're probably going to be put into different high risk categories. Like you and I want to have another baby. We're considered on the risk scale just for being over 35, right? So it's like, okay, you're in this risk category now because you're over 35. If you have a higher BMI, okay, now you're in this risk category, even though BMI is not an indicator of health.
Right. Yeah.
You have gestational diabetes, now you're in this risk category. So you automatically think, oh, I'm high risk, I'm over 35. Oh, I'm high risk, I have gestational diabetes. That is absolutely not true. Risk is a sliding scale. Like with any of those things, you can still birth with a midwife in a hospital, in a birth center, at home. There are certain things, like if your gestational diabetes cannot be controlled with food and you need to be on insulin, okay, you should be in a hospital setting. You're probably going to have to work with an OB. But the majority of gestational diabetes cases, it's controlled with diet and food. There's no additional things that need to be needed. But just knowing that you have that risk factor, it's a risk factor. It doesn't make you high risk. So now you have this risk factor.
Yeah.
Just because you have gestational diabetes, they're going to tell you that you're going to have a big baby. They're going to want to induce you early. They're going to want to do weekly scans at the end. They're going to want to be pricking the baby, testing blood sugar. So like knowing all of this in advance, you know what your options are. So, and at least you're prepared for it, and you can know what the research says, because what research does say is that 1 in 3 women are going to be told that they're going to have a big baby, and 1 in 10 women actually do. So we're telling 6 extra people, like, that they're going to have a big baby, when that's absolutely not true. 60% of the time that they're saying that, it's not true. So it's really important to be equipped and to like know these things going into it, because that can change your outcome, right? That can change the decisions that you're making. If you're being scared or fear mongered into an induction because you have a risk factor, you also need to know what risks come with potentially having an induction as well. And providers aren't sharing that information either.
Yeah, so I really love what you're doing, because obviously, like when you've been in it, a lot of times, like especially with me, like I haven't really been like putting in the research and all of these things. And with you and like educating all these, anyone who wants to learn about what their options are, it's good to know all these information. Because you're right, like there's a lot of people, even like when people get ultrasounds and like, oh, I have to be induced because they're saying my baby's huge, and all of a sudden their baby's only 5 pounds. Sound is not really that accurate, right? Like to know, to figure out the size of your baby.
Not at all. Yeah. And even like due dates aren't accurate really at all. Like they're assuming that every single woman's cycle is a 28-day cycle, and that you are ovulating on day 14. And even then, to say that your baby is fully ready at 40 weeks is absolutely insane, because every baby's different, every body's different. And to have like a hard cutoff date, it is pretty crazy. Like I know for a fact with my last birth, technically I had him at 41 plus 3 weeks, but we know his due date was wrong. Like so I was having 31-day cycles. So add 3 days. I ovulated on day 19, add 4 days. That's actually a whole week later, right?
Yeah.
And so, and even then, like I said, just to like think that like this certain day your baby's supposed to be ready, is not true, because how our bodies actually work the majority of the time is the lungs are the last thing to develop on the baby. And when your baby's lungs are fully developed, your body starts to produce surfactant, like this thing that like helps and puts you into labor. Then like your body sends a signal being like, okay, the lungs are fully developed, let's go. And a lot of times we're not like waiting for that. And so induction is insane right now. I was actually just texting my husband. I had taken my daughters to ballet this morning, and there was 2 pregnant women there standing talking, and between them they had 5 kids. Each one was an induction. The one was scheduling an induction for her next baby. The other one was saying that she didn't think she was, because her induction didn't go well. And I'm like trying to keep my mouth shut, because I don't want to like give unsolicited advice, but there's a lot of risk with induction. There are times when inductions are called for. Like I said, like intervention is called for sometimes, but the way that it's being pushed because of your due date, because of baby size, because doesn't necessarily make sense. You need to have the information. You can easily Google and research. Like they'll say your rate of stillbirth goes up past 40 weeks. You can Google what that is, and you can see what the actual numbers are. And it's interesting because the rate of stillbirth actually drops at 41 weeks, and then it's like higher before, and then it drops at 41 weeks, and then it goes much higher after 42. But even that much higher, it's about 16 in 10,000 babies is the rate of stillbirth past 42 weeks. So It's way less than 1%, like way, way less. It is higher for sure. At 40 weeks, it's 4 in 10,000. So yeah, you're 4 times more likely to experience this. But you're also a grown ass woman who can make decisions for herself and shouldn't be like fear mongered or medically coerced into things. And then they're not giving you the risk of inductions. And the majority of inductions these days have Pitocin, and Pitocin has a ton of risks. I interviewed on my podcast a lawyer who that's all she does. She defends OBs. She's a birth lawyer, and she defends OBs because she said it's in really unfortunate cases that involve either like injury or death. And she said every single case that comes across her desk involves 2 things: induction and Pitocin. There's so much that can go sideways with Pitocin. There is a time and a place. Again, yes, but also it should not be used the way that it's being used in hospitals right now for inductions, especially for elective inductions. If there's a medical emergency, they're trying to like speed things up because of something, but like fetal, and also, like I said, like fetal heart tones is the number 2 reason for C-section. And one of the big risks with Pitocin is fetal heart tones, like fetal distress. So Pitocin causes fetal distress, which leads to cesareans. It can lead to a lot of things. So Pitocin is not something that should be really messed around with unless absolutely necessary. Its postpartum use is a little bit different. It's very effective with postpartum hemorrhage. There's other things you can do for postpartum hemorrhage in the hospital setting, though. Even potentially home birth and birth center birth, they might be using Pitocin for postpartum hemorrhage. But even things like you can put a piece of a placenta in your mouth, and that helps stop postpartum hemorrhage. You can, like, there's a lot of tinctures and herbs. What is it? Shepherd's purse, yellow yarrow. These are things that you can like have on hand that you can take prophylactically to prevent postpartum hemorrhage. So just to like, as soon as like you're birthing, you can start taking these tinctures to make sure that you're not postpartum hemorrhaging. There's so many things that you can do outside of that, but just like I said, the majority of people are in the hospital system birthing. And so these are real conversations to like have with your providers when you're thinking about choosing the right provider, because that's also what's going to like make or break your birth. Like, how do you view induction, or how do you feel about going past your due date? That's a great question. And seeing how they answer, they could be like, well, I don't know, it gets really risky, stillbirth goes up, and see how they respond to that, because that also shows you, like, do they really trust in the process? Do they trust in your body, your ability to do this without intervention, if that's what you're looking for? Because even in like countries like France, which is very interesting, in France, your due date is 41 weeks, not 40 weeks. So we're seeing, like, here in the United States, they're pushing everyone to have an induction at 39 weeks because of the ARRIVE trial, which is highly flawed. And you could do an entire podcast on why. In France, the due date is 41 weeks. And honestly, the majority of women give birth around 41 weeks. That's much more of an accurate due date. It would be around the 41 week mark. And even when I've seen friends go through induction, I've seen it be so much smoother when it's at that 41 week mark versus 39 week or 40 week. Like, letting your baby get everything that they need and be in there as long as possible, I think is great. It's just like very interesting how we do things here in the United States. And then you look at our maternal health outcomes. Like, we're considered a first world country, and there are second world countries that have better maternal outcomes than we do in the United States. And it's not because of people doing home births or birth center births. It's because of hospitals. And I mean, you even look at like the reasons people die in the United States, and misdiagnosed things or hospital errors or doctor errors is like number 3 for reasons why people die in our country. So it's like, you can't just blindly put all of your faith and trust in the system. I think that doctors are amazing and they've worked really hard to be where they are, and we definitely need help sometimes. but they aren't the end all be all. And midwives kind of view birth different. So your entry level care for midwifery, I think, would be amazing. That's how it is in some countries in Europe. Like everybody sees a midwife. And then once, if you have something that requires further attention, then you would risk out and go to an OB. And those countries who practice that have much better outcomes than
That's
we
true,
do.
though. It seems like they consider. No, go ahead.
I think it's like lagging. It's like lagging behind a little bit.
It is. It is. But I think with this one, though, they record yours separately, so hopefully it's recording everything, and then
Yeah.
it will like connect them all.
Okay.
But yeah, I was gonna say that here it seems like here in the United States that they consider like pregnancy and birth like a almost like a disease or like a medical emergency, even though it's
Yeah.
not. Like they're kind of like always in a rush to like get you to your baby and whatnot. And that's actually what happened with my younger sister when I went with her on her first birth, and I guess she had like failure to progress, and so they, added pitocin, and then the fetal heart tones decelled, and then she had to have an emergency C-section. And so that's basically like what you described. So, but with my first, it was the epidural that made the fetal heart tones decel. It was only just twice, and then but DJ was so nervous because I had been in labor for 3 days, and so we opted for the C-section. But yeah, it really having a hospital birth and then experiencing a home birth are like two different kinds of world, right? Like you're in the hospital and you're trying to rest and recover, and they're like in your room every 30 minutes trying to check something.
Yeah. Yeah. Even during labor, like the blood pressure beeping cuff is constantly going off. So when I'm a doula at like a birth in a hospital, I turn the volume off. Like I just tell the nurse that I'm turning this off because it's like continually beeping, or like when it goes off, I hit the off button when I'm in there because I'm like, this is so annoying. The amount of like, yeah, just like cords, right? And
I
different
feel
things.
like it adds to the stress.
Right. It does. It does add to the
Yeah.
stress. I mean, when you think about it, like most mammals, when they're birthing, they're seeking solitude. They're going somewhere safe and alone to birth. And here we're under bright lights and connected to a bunch of cords, and your body actually naturally goes into fight, flight, or fawn. And what happens a lot in the hospital setting is fawn. So that's where, like, let's say you are in the hospital, you do have an epidural, and the doctor comes in and is telling you something, you are agreeing because your body knows when they're like, okay, well, we need to start you on Pitocin because your body's not moving fast enough. And you didn't want Pitocin, but now you're kind of scared because your body knows, like, I can't run away right now. I'm going to agree because I'm scared. Like there's a whole underlying hormone response happening in these situations.
Yeah.
And we don't like really talk about that either, because I can't tell you how many births I've been a part of where the person has just been so made up in their mind of what they want. And as soon as the doctor comes in and says something, of course, when you bring your plan to your doctor, they're like, yeah, it looks good. And then they show up to the birth and they're like, oh no, like we're going to do something else. Or they're throwing a lot of other things at you. And they've been like, oh yeah, we can totally do that. And then it comes to happening and they're not doing it. And you're just like, okay, like we're scared to speak up. And so I think that that's why I think having a doula is great. I think like doing the research for yourself is great. However, you're the one in this situation, and depending on how long you've been laboring or what's going on, you might not be of mental clarity to be making decisions, or you don't want to be advocating for yourself when you've been in labor for 3 days. So then the next role is your partner, right? Like I'm sure it took DJ a minute to like get on board with like home birth, or maybe he was right away, but after experiencing that, like if you ever were to go back to the hospital, he would absolutely say something. Like if the doctor was doing something that they weren't supposed to, or that you didn't agree to, or like let's say you had the baby and they just straight went to cut the cord, he'd be like, excuse me, like no, we're waiting on that. You
Yeah.
know, like we so like easily comply with everything. And that's like also what I see it a lot at a hospital versus the partner not speaking up or being scared to speak up. And they're like, ooh, you know, and thankfully Vito is not that way at all. He's like, all of our appointments that like we ever had took forever because he'd ask like 1,000 questions, like to the point, and we were with midwives, so our appointments were like 45 minutes long, and they'd be like, okay, like we have to wrap this up now because you won't stop asking questions. And when we were at the hospital, like, you know, we had a situation happen. Our daughter ended up in the NICU, and they were trying to like kick him out and like stuff. And he's like, no, he's like, I'm staying with my daughter. And they're like, well, you can't be in here right now. And he's like, I can't be in here or you won't let me be in here. Like, I'm absolutely not leaving her side. And he had to like advocate for that. But I know a lot of people would be like, hey, you can't be in here. And they'd be like, oh, okay. Like you just feel like, okay, the doctor said no, so like I have to listen. And like one thing that I always tell everybody is that the hospital has policies, but that doesn't rule over your bodily autonomy. They have their policies and procedures that they have to ask or do or say, but your job isn't to agree to them. Your job is to have an informed consent. You can say yes or no. They can be like, well, this is our hospital policy that you have to birth on your back. And you could be like, thank you so much for letting me know about your policy. I feel powerful on my hands and knees. Like, I feel comfortable in this position. I'm not changing. You don't have to do anything that they say. And so I think people also get nervous in those situations where they're like, okay, well, let's get you on your back so you can push. And you wrote on your birth plan, like, no birthing on my back. But now they're telling you to get on your back. And you're like, oh, okay. Like, no, you don't have to. And it doesn't have to be like a fight either. Like, it doesn't have to be this huge confrontational thing. You can just be like, no, thank you. I'm comfortable where I am. Like, no, I'm going to push here.
Yeah.
You know, and if they're like, oh, well, and it's like, okay, well, if you don't, you can even just be like, I'm going to birth on my hands and knees. And if you don't feel comfortable there, then can you please bring a provider who does? Like, this is your birth and you have to 1,000% take control
It's
over
always
it.
good to have, yeah, it's always good to have an advocate with you, be it a doula or a partner who really knows what you want and kind of also knows how everything works, right?
Mm-hmm.
All right, technical difficulties, but we'll keep on going. So yeah, it's definitely great. It's a great idea to have an advocate with you, be it a doula or your partner who's well educated on, let's say if you're birthing in a hospital, so they're well educated with true informed consent and how their rules are and what you can say no to. I'm sure you can say no to everything, like Liz said, which
Right.
we did that. We said no to everything, and after you say no, I don't know if it's the same for all hospitals, but every time we said no, they're like the end of their statement is always like, there's a risk for imminent death. Like really?
What?
Yeah, yeah, it was insane. Even DJ was shocked, like after like obviously when we got home and stuff, like he couldn't stop talking about it when it was just always like at the end of the paper there was just always something about like a risk of dying. Like I'm like, okay, great way to scare someone who's already like stressed out.
Right. Right. Wow. Yeah, I know. That's like I was saying before, like, I just feel like when it comes to induction and like interventions, they try to scare you into them, but they don't ever give you like the risks of them. So it's like, I was actually at a birth this year where the doctor played the dead baby card and was like, basically told her if we didn't do this thing, like her baby was gonna die. And I had never been at a birth where like a doctor just straight up said it like that. And I was
Yeah.
horrified. And then after he left, like I looked at her and I was like, listen, like let's go over all, like that's really scary to hear. That is not like obviously birth can be unpredictable, but let's go over what all of your options are. Like you don't let him scare you into something because what he's basing it on isn't even like research backed. You know, like I even asked the nurse what category the heart tones were in, and she's like, it's a category 2, which is what most babies fall into. And she just wasn't dilating as fast as he wanted her to. He was trying to do cervical checks every 45 minutes. It was insane. Yeah, it was just an all over insane thing. And when she denied a cervical exam, he told her baby could die, that she wasn't like progressing fast enough, that her baby, like all of this stuff. And I'm like, listen, there were certain risk factors at play. And so we went over everything. I'm like, you're the only one who can make this decision. But let's go over what happens if we wait longer. What happens if we get a C-section right now? What happens, you know, if we put a time limit on it? Let's say we're going to go for 3 more hours and see what happens. And she ended up having a great vaginal birth. She was VBACing. She had had a previous C-section. Yeah. So this was a VBAC birth. And he was like, you're not going to have a vaginal birth. I should have taken you as a C-section hours ago. He was basically chewing her out. And then hours later we had the feedback. So, but most people would be scared into being like, oh, okay, like you're right, you know, instead of pushing back. And that impacts a lot of things, like future children and births. Like once you've had a couple of C-sections, like I know where I live, there's not a lot of doctors who will do a vaginal birth after 2 C-sections. The majority won't even do it after 1. They'll tell you that you can, but it doesn't ever really happen. So it's, you know, it does affect a lot of things, and it sucks. Like what sucks is to hear that, like to go back and be like, if I had known this, my birth could have been different. If I knew the information that I have now, things could have turned out different. But we can all do that, right? With so many different things in our lives. And it's like, we just have to take the information that we have now and move forward and advocate, like, you know, advocating for yourself and for your baby. Like it starts a great practice before having kids, starting to advocate for yourself with providers and practitioners and for your health. And as I said at the very beginning, as women, I just feel like we're so dismissed. It's like, well, you're a woman, you are going to be moody and cranky and this and that. And it's like even when it comes to hormones, like estrogen dominance and stuff, like that could look like when you have really high levels of copper. It can be, that's what I've been dealing with, you know, but most doctors would be like, your estrogen looks normal, this looks normal, this looks normal. Then you look at my copper levels and they're off the chart, and you're like, whoa, no wonder you're having all these period symptoms. No wonder you're having these other issues, you know, like people aren't looking into that stuff. So it comes with like advocating and looking for answers and getting yourself healthy and learning to not just take what's handed to you. Like right before Vito and I got married, they wanted to put me on birth control again because of my periods. And I'm like, absolutely not. And I ended up, because I had tried birth control like once, and I was on it for a month or 2, and I was a psycho. And I was on the lowest dose possible. I got put on it at like 15 years old for my periods and took it for a couple years, then got off. And then in my 20s, tried it again, had a terrible experience. And I'm like, no, I didn't feel like myself. I didn't feel like in control of my emotions. Like it was crazy, like to the point where my boss was like, are you okay? And I started like bawling. I'm like, I just started this birth control. I was like crying at work. It was crazy, and there was like no lower dosage that I could have taken, and I was like, no, I'm not doing this. So, and then I learned more about my body and how hormones work and how hormonal birth control, like what most women don't know about it is they think that it's like you take your placebo pills for a week and you get your period, but you actually don't get a period at all when you're on hormonal birth control. You're actually having a withdrawal bleed from being off the hormones. To me, I didn't feel like it was like to suppress my period for years. Like there's health benefits to ovulating and menstruating. You know, I didn't want to mess with that. So I, you know, always had to look for alternative things. And thankfully, like I've been able to find people who have helped me, and it does play into everything. You start to learn how to advocate for your health as a mom or just like as a woman. And then when you get pregnant, you have to advocate for yourself. And I feel like we're kind of made in pregnancy to second guess ourselves, to second guess our bodies. And then that plays into like the birth. And you start getting scared into things like in your pregnancy, and then you get scared into things in your birth, and then that plays into like who you show up as a mother. And so it is so important to have advocates, to have people who really know what your birth plan is and can support that, and they know why you're making these decisions. So when things arise, that they can help you make alternative decisions. And finding providers who are going to support that is super, super vital. Like with the VBAC thing, like a lot of doctors will be like, yeah, we can try for a VBAC, but they don't tell you that they have like all these stipulations surrounding it. Like you can't go past your due date, you can't be induced, or we have to induce you. You have to get an epidural just in case we need anesthesia right away. You have to do X, Y, and Z. Or they're like, yeah, you can, but then toward the end they start being like, well, the baby's kind of looking big and you're low on fluid, and they start planting all these seeds, and then you're like, yeah, you're right. It's probably just safer to get a C-section. And actually having repeat C-sections is not necessarily safer. So they're not telling you the risks of repeat C-section, which especially if you've had 3, 4, the risks get pretty scary. And they're not telling you any of that. But also, like, once you have a vaginal birth after a C-section, your risks go like completely out the door, basically. So it's all how it's worded and all how it's portrayed to you. And so I'm so passionate about educating women on their options, about them knowing that they have options, and teaching them how to advocate to find, and even just like find some providers that will support them in the birth that they want.
Definitely. I think I know somebody who, like, well, with me, with my VBAC, the first thing they always say is, oh, the uterine rupture, right? That risk of
Right.
uterine rupture. But they never, like you said, they never mention the risk of having another C section. And I know someone who's had 4 C sections because no one ever told her about VBACs.
Mm-hmm.
Like, it's insane, but like how they just, yeah, they just really make you lose your trust in your body the way that they scare you, and like that, all those seeds that they plant in your head, that it's that your whole birth is a medical emergency, basically. Like, it's almost
Right.
like telling you, hey, don't get pregnant anymore.
Right. I know. Yeah, it's hard. It's hard to find those providers that are going to be supportive with it. Um, I mean, there's so much that we could go like so much into like every single topic, but um,
Yeah.
I mean, because I could like, this is like what I love to do, and I could talk about all of it all day long. Because when it comes to birth, there's risks with everything. As I said before, like there's risks of going past 42 weeks, but you're not given the risks of both sides. And so that's like what's really important to consider, and to like have those conversations with your provider, and to not be afraid to ask questions and not be afraid to change providers if that's like what you need to do. I really, really hope that there's a shift coming soon with the way that maternal health is going in our country. I think that, so there was a hospital in Denver that I can't remember exactly what all they implemented, but they implemented a few rules and their C-section rate dropped drastically. I believe that they now have a 12% C-section rate, which is like unheard of. And the reason is because this hospital stopped inducing women before 41 weeks. They held each provider personally accountable for their C-section numbers. So like at the end of the month, you would know what percentage, each provider knew exactly what percentage their clients had C-sections. And there was like something else that they implemented, and I can't remember it right now. But I think that if we held providers accountable, then that would change, because after they told the providers their C-section rate, it dropped, which meant that
Yeah.
they were performing almost double the amount of C-sections than when they were being held accountable, and they were unnecessary. It's super, super interesting. Like when you look at the, different studies that have happened or things going on, and I'm like, man, it's crazy because I live outside Chicago, and you would think that there's a ton of options here, and there's really not. Like if you're birthing outside of what hospitals consider AKA normal. So let's say you're having twins, you're having breech, you're having a VBAC, you're doing anything, you have hardly any options at all, which stinks because all of these are variation of normals. They could be a potential risk factor, but it does not automatically make you high risk. It does not automatically mean that you have to have a C-section. It doesn't automatically mean you have to have all of these interventions. So my husband is well aware, because like I said, we want to have another baby, that because even the midwives here, even the home birth midwives are very limited when it comes to these things. So I know in California it's the same, right? Like home birth midwives aren't supposed to do certain things, but in other states it's okay. And we're only a couple hours from Wisconsin. And so Vito knows that if we were to have twins or I would be breech, I'm like, we're driving over the border, baby. We're driving over the border. That's where I would go because they know how to deliver breech vaginal births. They know how to do these things safely. And that's like an important factor in this too. Like when it comes to breech, a lot of women are told like, oh, then we need to schedule a C-section, which is really unfortunate because the majority can be vaginal births. For anybody listening, you can look up Dr. Stu Fishbein. He's amazing and he does breech vaginal births. He has it's called Breech Without Borders. And he and a lot of other people travel the country teaching breech birth. And he went to Wisconsin. He came to Chicago to this one hospital here, even though a lot of people there still don't do it. But he's great and like a great resource, and you learn like, oh, breech isn't scary. The reason why we have to deliver C-section is because providers don't know how to deliver breech babies. So it might be safest to have a C-section if you're in an area where there's not one provider who knows how to deliver vaginal breech, because you don't want them trying to do it when they don't know how. Like I'd be like, don't touch me. Like if you don't know how to do this, you don't have confidence in doing it, don't do it, you know? But it's unfortunate that you're stuck without an option because you should have one. You should have the option to be like, okay, I'm going to find a provider who will do vaginal breech. And there's just a lot of places where you can't find one. And then because again, it's one of those things where they're like, oh, we can attempt, we can see, but they call it pretty easily. So yeah, it's unfortunate that there aren't more options and more variation of normals being being taught when it comes to birth, because we're made to be like to get that kind of like distrust in ourselves and to just like rely on whatever the doctor's telling you when like it might not necessarily be true.
Right? Yeah. I love that you mentioned Dr. Stu because he was on one of my options for my midwives with my first VBAC, but then obviously he was very pricey, right? And then we had to drive far, and that's when this one other midwife that wasn't practicing. She was the one who told me, she's like, "Well, if you really want him, you should beg, steal, or borrow, basically, to have him." But then, obviously, like DJ got scared about the rupture thing because the closest hospital had a VBAC ban because they don't have a 24-hour
Anesthesia,
anesthesiologist.
yeah.
So I compromised. I found a VBAC friendly OBGYN who had a midwife in his practice. So essentially, it was just the midwife doing my prenatal care, and then he was going to be there for my birth. But I had the accidental home birth, I think you know that. So it worked out for me, I guess. Like, oh, I didn't have to shell out $8,000. It was, if DJ was not scared, I probably would have still, like gotten doctors too. Because to me, like, you can't put a price on something, like that you really want, and it feels right? Like, why would you want to sacrifice? Like, to me, it was like, well, that's an investment because I'm really dead set on having a VBAC, and I really wanted to have a HBAC, which happened. So it was great. And I
Yeah.
didn't have to pay him, but it's okay.
Yeah, yeah, I know. And that's the hard thing. Sorry, is that really loud?
It's okay. I have a rooster in my background.
Well, I think our neighbors have sounds like their like lawn. Let me just shut this window quick.
Okay.
Yeah, it's really unfortunate, that again, it comes down to options. Like right now, I'm
Yeah.
doulaing for somebody who I've done a previous birth for, and this time around, she really wants to do a birth center, and her insurance won't cover the birthing center. And so my insurance covered our birth center, but it will not cover home birth. So it's just really unfortunate that we don't have options. And let me tell you, my hospital birth was because I ended up getting an epidural. My hospital birth was almost $50,000.
Yeah.
Okay, insurance covered it. A birthing center birth was $7,000, and insurance covered it. So, but it's like interesting to me that insurance won't cover a birthing center birth, but they'll cover a hospital birth. When usually the birthing center and home birth are significantly cheaper.
Yeah. Yeah.
It's just very, very interesting to me how it all works. And I mean, it's all corrupt though. It's like from the system down. And that's also
Yeah.
why providers make certain decisions. It's because of there's fear of litigation, there's fear of certain insurance things. So it all factors into all of it. But yeah, I really hope that there's something that changes where we get better care. Like we get more options for birthing women all across the country, that they are able to have access, whether they want to birth in a home birth or a birthing center, that they're able to get options to do that, because it's really frustrating because a lot of people want different, but their
Yeah.
insurance won't cover different, and it is expensive. So that's a huge expense for some people. I even told Vito, because we've never done a home birth. We did a hospital birth center, but if we have a fourth, it'll be a home birth. And he's still trying to get on board, but he will. But I told him, I'm like, if that's something that then we need to start saving up for now, or I might not be able to go with the midwife that I want, because the midwife that I want doesn't take insurance.
Yeah.
So I might be able to get some of it covered through a different midwife. It's just it's so frustrating that you can't just choose and have insurance cover it and blah, blah, blah. So I hope that something changes in that area. Here, you hear in the media so much about women's rights or reproductive rights, but nobody really talks that much about the maternal health crisis
Yeah.
that's happening, and the options there. I think that my body, my choice goes way beyond abortion. It goes into the care that you're receiving as a woman, and
Yeah.
not being fear mongered into decisions, and having bodily autonomy in birth, and not being medically coerced into things that you don't want to do. So I really, really hope that something shifts. I think it starts with these conversations, right? It takes one person to hear something and be like, oh man, maybe I do need to find a new OB. And I think a lot of people sometimes feel loyalty, like they've been going to the same OB their whole life. So when they get pregnant, they just stick with that person. This is your birth. You don't owe them the right to
Yeah.
be at your birth just because you've gone to them your whole life. Maybe, or even IVF, people who have gone through IVF, maybe this is the doctor that helped you get pregnant, but maybe they're not the person to deliver your baby. And that's okay. This is your birth. It's a big deal. We plan for, you plan for college, you plan for marriage, you save up for these different events. And then when it comes to birth, I just feel like there's not much that goes into it, as far as being educated on health going into it, being educated on your options, the plans, what your risks and benefits and pros and cons and all of that are. So I wish that there was more on it. So I'm grateful to be on the podcast to talk about it, because I feel like it just starts with a couple of people hearing these conversations and hopefully getting something out of it, and then telling their pregnant friends when their friends get pregnant, be like, oh my gosh, I heard this podcast with this doula. You should listen to it.
Right? Yeah. And we definitely, there's so much to talk about when it comes to birth and women's health care and maternal care. And we can definitely, you know, have another 100 episodes all about this because it is very important, right? Like, health insurance itself is already pretty expensive, right? With all the deductibles and the premiums and all that stuff. And then you don't really get a choice, like all the options available to you. It's kind of, I don't know, it's kind of stupid. Like, yeah, I'm paying for health insurance. Why can't I choose to have a home birth with a midwife? Like, why wouldn't
Right.
you cover that, right? Because
Yeah.
obviously, because it has to be medical, or I don't know. It's really mind blowing to me when someone's already
Yeah.
spending so much money on insurance, and then you don't get to have the provider you want or where you
Right.
want to birth. Like, hey, what if I just want to birth under my giant oak tree? The midwife. Like, why can't I do that? Right?
Mm-hmm. Yeah, exactly. I'm with you.
Yeah. Well, maybe we'll end that on this note, and I'll definitely want to have you back on so we can talk more about births and having all these options. Maybe Liz is going to start a grassroots movement and fight for that.
Yeah, for real. I mean, I think about it all the time. I'm just like, I think like, what can I do like on a deeper level? Like, I've gone on other podcasts. I have my podcast. I have, some stuff, but it's like, man, like, how do you reach more people? How do you honestly like boycott providers who continually fearmonger? Like, I know that where I live, this one OB ended up going, I don't know if she went out of practice. I don't think she went out of practice, but she moved and she had like a 70 something percent C-section rate. And every single like nurse that worked for her like quit because she was awful. And so she keeps like skipping around, like going to different places,
Yeah.
and keeps losing staff. And it's like, no, you need your license taken away.
Right?
How are you still practicing? Just more accountability. And it's not just OBs, there's midwives too. There are midwives who aren't great either. I would say it's a
Yeah.
lot less likely in the midwifery world, but it still does happen. Even with doulas, I've had people be like, I had a terrible doula experience. And I'm like, oh my gosh, I'm so sorry. Because that is like not how it's supposed to be at all.
Yeah.
But for the most part, it's like, man, I just feel like people just really want to be heard. They want to be validated and they want to have great birthing experiences. And that's whether you're having a medicated birth or an unmedicated birth. As long as you're validated, heard, you had informed consent, that's really like what counts. Interventions are there for a reason, choices are there for a reason, but feeling supported in it is like what you're going to remember. You're going to remember how you felt during your birth. And for people listening too, like if you want to know more about your birth options and how to advocate, I actually have a birth course, the birth plan prep course. You can go to elizabethjoy.co and it's on there and it'll walk you through like all of your options in labor, and what the alternatives are, and then again like how to advocate for yourself. So like if you're like, oh, I don't want pitocin, well, when you're presented with the option, what are the alternatives? What are different things you can do? What are the risks with it? How do you know when you really need it? How do you advocate? So yeah, definitely check that out if you're interested in you're listening and you're like, man, I just really want to know all my options. I got you covered.
Yeah. And we're going to have that on the show notes as well. And you can follow Liz. You can find her on Instagram. Remind me your handle.
Sandoz.
Easy, right?
Yeah, Sandoz.
Everything will
Say
be in
and
the
feels.
show notes. So, but yeah, thank you for being with me today and sharing your wealth of knowledge. And we're all going to keep rallying to have all these options. Maybe
Mm-hmm.
RFK will help us.
I know. I was like, man, can I sit down with one of these dudes and just like be like, hey, listen, you guys talk about all this other stuff, but what I'm hearing nobody talk about is this. Like, I've heard some people talk about the maternal health crisis, but but not this. Like, let's start holding OBs accountable, and let's make sure that we're actually having informed consent. Like, if your provider comes in the room and says, okay, I'm doing a cervical check, that's not informed consent. Like, that's not having bodily autonomy. It's that person coming in and being like, hey, I would really like to check you right now. Is that okay? Getting your permission to touch your body, getting your
Right.
permission to like to do anything. Like, they shouldn't just clamp and cut your baby's cord. That's not informed consent. They should be saying, okay, we're gonna do this, not we're gonna do this now. Like, hey, is it okay? The way that things are practiced, it's like everything's just happening to you, and you're not in the driver's seat of your birthing experience unless you're coming in equipped with knowledge, and most people aren't. So we need a birth revolution.
Right? Yeah, yeah. No, that totally makes sense. It almost like they're there to tell you what's gonna happen, and you have no choice but to just
Right.
agree to everything.
Mm-hmm.
Yeah,
Yep, exactly.
we
Mm-hmm.
definitely need a birth revolution.
Mm-hmm. I know.
Liz,
I
we're
know.
gonna start one.
For real. Sign me up. We march at dawn.
All right, all right. Well, thank you again, Liz, and I'm sure she's gonna be back on here, maybe with a birth revolution for everyone to join.
Yeah, for real. I know. And then you're gonna come on my podcast too and talk about some of your health stuff. So I'm excited for that to happen.
Yeah, looking forward to that. Bye.
Bye.